All right, so talked about some food choices that can decrease inflammation. We've talked about controlling blood sugar spiking to control inflammation. Antioxidants, dietary. We have this amazing dietary option found in your grocery store for inflammation. Omega fatty acids, foods to eat, foods to avoid, again, found in your grocery store. Nuclear modulation, this is genetics. What are your genetics? We can check your genetics and then we can make modifications based on that. But know that food affects your genes. We talked about sleep, why sleep is really important for your immune system and inflammation. Now we're going to talk about exercise. So stretching muscles, the actual motion of stretching a muscle releases these chemicals called myokines. These chemicals actually balance out inflammation and calm it. So you can think of myokines kind of like your second version of a freeze ray gun. So myokines help calm inflammation. One reason we really love resistance training is because of the muscle stretching involved and triggering this anti-inflammatory effect. So the added benefit to movement and exercise is by maintaining muscle mass. So the fact that muscle is your metabolic currency is huge. You know, what do I mean for that? Having muscle mass is really what helps you in your resiliency to fighting illness. So they found that people who are obese or who have very low lean muscle mass are some of the worst cases or worst prognoses, and even things like COVID. Muscle mass is your metabolic currency. It helps control those inflammatory reactions because when they stretch the muscle, you release myokines. If you don't have much muscle, you're not going to be releasing much of these anti-inflammatory components to affect your system. So we know that movement and exercise builds lean muscle mass. And we know that stretching those muscles is what causes those myokines to be released. So always remember, muscle is your metabolic currency and you have to spend it wisely. There's something that we do see called sarcopenia, and sarcopenia is this gradual loss of muscle mass. It typically starts at age 30. You have to actively prevent sarcopenia or it will progress, meaning you do have a gradual loss of muscle mass. That can be prevented, but it takes active effort to do that. So again, movement and exercise, we need to maintain that muscle mass so that we can work on our inflammatory cascades by prevention. So there's two things that can exponentially decrease your muscle mass. And I again find this fascinating how this works. Inactivity is one. So a sedentary lifestyle, we mentioned this last month. A sedentary lifestyle starts muscle wasting in 2 days. I don't know about you, but I don't know if I have any muscle left after last year. The amount of sitting and computer work and administrative type work in this crazy type of environment and homeschooling, it's really scary to think 2 sedentary days causes muscle wasting. So it takes a lot of effort to make sure that you maintain your lean muscle mass. The second thing that can cause a decrease in muscle mass is also really important. Inflammation. Inflammation breaks down muscle. So now we have this system of this vicious cycle, right? Inflammation breaks down muscle, and a lack of muscle decreases your ability to calm inflammation. So for those who have inflammatory issues, you have to be very vigilant about keeping lean muscle mass because your system is in a current state that wants to break it down even faster. So inactivity and inflammation actually are harder on muscle. It's even more important than ever to incorporate movement and exercise and strength training into your daily lifestyle. So this movement, we've been learning all along that muscle cells are the secretory organs and they secrete these really great hormones and peptides and these myokines. So we want to keep that in mind. We can help control inflammation by stretching muscles. The muscles release these wonderful myokines to calm inflammation. And if we are not doing that and inflammation kicks up, we're going to break down our muscles even faster than we ever would have imagined. So, principles to reduce inflammation. Food choices, control your blood sugar, antioxidants, omega fatty acid intake and the balance of 3s to 6s,